Okay, this is Module 2, and in Module 2 we're going to deal with ethical issues when you're working with children, couples, and in family counseling situations. We're also going to talk about ethical issues in group counseling, because group counseling poses some unique challenges in terms of things like confidentiality, so we'll talk about that a little bit and what you can do in those situations. Personally, I love working with kids and families, have done so for years, and I think it's a very, very important part of social work and clinical counseling. So we're going to talk about some of the challenges that it poses when you're working with kids, families, and all of those situations that can arise when they have different goals, different needs, and different problems. So let's talk about informed consent in children and adolescents. Now, although minor clients do have an ethical right to privacy and confidentiality, what's different about them is that the law tends to favor the rights of their parents over their own rights because they're minors. So when you're working with kids, you can't guarantee that nothing that is said will be transmitted back to the parents. You need to let them know that information will be disclosed to the parents, and that the parents have a right to that information unless special circumstances apply. So I always tell minors that I'm working with, I can't guarantee blanket confidentiality. If there is something that you'd like for me to keep confidential, we will talk about that, and we will talk about why it might be in your best interest to keep that information confidential. And sometimes it is. You may have a situation where a parent is abusing a child and the child discloses that information. That information is not something you're going to want to immediately share with the parents. You're going to need to call, because you're a mandated reporter, and report that to the authorities, and they may be the ones who need to handle that with the parents. So that should be disclosed at the outset. Now, it's very, very important that you disclose all of this information to the parents too, and not just the child. You need to let them know, though you have a right to your child's information, and I will share that with you as often as I can because we work as a team in this counseling relationship, there may be times when I try to respect your child's confidentiality, and you may set those limits or go over those limits with the parents at the outset of counseling. That's a part of what informed consent is all about. Make sure that you have that in writing, because if it isn't written, it didn't happen. So make sure anything that you do agree on is in writing and signed off on by the client, the parents, or, you know, if it's a minor client, obviously, then it would just be the parents and yourself. And usually there are agency documents for informed consent, so the agency will provide you with the documentation to cover that with them. Now, we just talked about mandated reporting, and that would be an exception where you may not be revealing that information to the parents if they are the ones abusing or neglecting the child. You can go check this link to see if mandated reporting applies in a certain situation, and it's going to be codes.ohio.gov/ORC, and you can follow that link and see if it's a mandated reporting situation. Obviously, child abuse or neglect are mandated reporting type situations. Now, if it's someone else that's abusing the child and the parents had no knowledge of this, then it would be important to discuss with the child the fact that you would like to disclose this to the parents. The parents need to know in order to better protect their child in the situation, and they need to know what's going to be happening. So it's a very sensitive thing to do and a very important thing to do. Now, when you do report as a mandated reporter, you are immune from civil or criminal liability for making that report. In other words, clients can't get angry with you for making that report because you have to do that by law. And it's important that you cover that in your informed consent, because a client could successfully sue you saying, hey, you never told me that that could happen. But make sure that you tell them, and it's a part of your informed consent at the outset of treatment, and then you're protected and you have immunity from civil or criminal liability. Now, if you report information that is false, that you know is false, that would be a different situation, obviously, and you could be civilly or criminally prosecuted for that information. Now, failure to report means that a mandated reporter could be charged criminally, and I have seen situations where agencies or individuals failed to report, and that's a big problem. I know that when I have worked with adolescents that commit sex offenses before, I've had clinicians that were reluctant to report that to the authorities that this person had disclosed sex offenses during the context of an assessment, an individual session or group, because they were afraid that would damage the therapeutic relationship. One agency at one point told me that we don't disclose new offenses that clients reveal in our therapy group because it's just not our agency policy and we don't want to damage the therapeutic rapport. Well, that's illegal. I had to make a report to the authorities and report that abuse. Now in that particular case, it was very, very important that I did that because one of the victims of that perpetrator was now in counseling. This was a young person, and they were having all sorts of behavioral problems, and the family could not figure out why. Had I never made that report, they still wouldn't know why their child was having behavioral problems. So there are very, very important reasons to report abuse, and for the most part, the most important is to protect kids and get them the help that they need. And that's what happened in that case. Now, with informed consent with children and adolescents, try to involve the parents as much as possible and get those mutually agreed on guidelines. Standard 1.07 actually says that when social workers provide counseling services to families, couples, or groups, that social workers should seek agreement among all parties involved concerning each individual's right to confidentiality and obligation to protect that confidentiality of information shared by others. We should inform participants that we cannot guarantee that all participants will honor such agreements. Now this is important because it says that when you're working with a family and one family member decides to disclose what happened outside of that session about another family member, you couldn't control that. That's something that we as social workers simply can't control, and it's important that we let our clients know that whatever is said in session among members of the family be kept in the session if at all possible, so that you don't have unauthorized disclosures of one family member's information by another family member outside of that therapeutic session or relationship. Now, what I try to do is tell parents that you will be entitled to general information regarding your child's progress in counseling, but that certain specific struggles that a child may have, I'd like to try to keep those confidential unless I need to let you know, or there's serious issues, or there's imminent risk of harm to the client or to others. That way kids do feel like they can talk fairly freely. A lot of times this applies to relationship situations, because when I work with teenagers, one of the biggest issues they're always dealing with is relationship drama. And they don't necessarily want all of that information in specific detail going back to their parents. And I do try to honor that if at all possible, unless there's risk of harm. And then I let the parents know. I do always let parents know how their kids are doing progress-wise. I think it's very important to do that. I have gone into communities and set up counseling programs to replace local counseling programs, because those local programs would not involve families in the treatment of their children. I don't see how you can be effective without doing that, and we're all about ethical practice, so we need to involve families in the care of their children. Remember, as many issues as we try to help children with, if they're going home and the family hasn't changed and the family system is still behaving the way that it always did, it's very unlikely that your intervention is really going to work long term. So it's very important to make family members an important part of the team. Now, question that I get often is, can a minor enter into a counseling relationship without parental consent? Well, in most states, they can enter, at least initially, a counseling relationship, or the counseling can be court-ordered if there's a situation that mandates that. But in Ohio, minors 14 and older can request outpatient mental health services without consent or knowledge of parents, but it's limited. It can be 6 sessions or 30 days, whichever happens first. Now, this protects situations where perhaps the child is being abused by a parent, or for some reason has run away from home, is unhappy at home, is experiencing problems at home that they just have not been able to discuss with a parent yet. And so it's important to be able to at least initially start working with those kids, but the goal should be, hopefully, to either fix the familial situation, protect the child from abuse that's ongoing, or help the child to help change the family system if there's a problem in the family. Okay, so When we're dealing with couples and families, you have several different people in the room. They all have different needs, different goals, and different problems. So, who do we have primary responsibility to? Well, that's an interesting question. Is it always the father? Is it always the child? Is it always the mother if she's the one that comes in with the identified problem? Who is the primary client? Well, it depends. If one individual is coming to you and saying, I have this very definite problem and my family is not listening to me, then the individual who's identified may be the child, and you may want to work with them as the identified client. I try to work with the family as a whole as the identified client, and that has certain ramifications, and here's the reason that I think it's important to do this, because the ramifications have to do with like secrets, problems, or issues that other family members are not aware of. I don't want to be pulled into a situation where I'm colluding with one family member against other family members. So typically I'll treat the whole family as a client, and I won't see individuals separately. I will work with the family together and attempt to work on the family system. That keeps me from being pulled into family secrets whenever possible. A lot of times you run into this in couples work when you're working with people who have had extramarital affairs, and one member will want to talk to you and they will reveal information about those affairs, and they will tell you, you cannot tell my partner this. Well, it's very difficult to do appropriate counseling with couples if there's so many secrets going on in that relationship and you can't reveal information. So I try to work with the whole system together, and I typically try not to see people as individuals within the context of those sessions unless I've explained up front that any information that I think is important for all members to have, I will share as a part of the therapeutic intervention. And again, that's something that you can do during the context of informed consent. But it sure is a tricky problem. Our Code of Ethics suggests in 1.07, that standard, that social workers should inform clients involved in family, couples, marriage, or group counseling of the social workers, employers, and agencies' policies concerning the social workers' disclosure of confidential information among the parties. So again, what's important here is that I am doing an informed consent process where I let all of the individuals of the family or the marital couple know, or even the group, if it's group counseling, know what my policy is regarding confidentiality. And as a part of that, again, I remind them that if one person in the family or in the group reveals information, I cannot necessarily control that, so I cannot guarantee perfect confidentiality. What I do let them know is that I won't collude with any one member and keep secrets. I just think that's a very, very bad policy as a social worker. So, we do need to consider that the status of one partner or family member should not improve at the expense of another partner or other family member. Now, this is another thing that's very important for us to remember, because sometimes we get in a situation where we can see that someone in a family or group situation is being oppressed by the other members of their family, and we want to improve their situation in the family. But if that means that they're now leaving the home and are not going to be spending as much time with the other family members, we're impacting the other family members in the system too. We cannot improve the lot of one family member without assisting the other family members. So we need to keep things like that in mind as we therapeutically intervene in these family and couple situations. We cannot improve one side of a couple in a couple's relationship at the expense of the other partner in the couple's relationship. Now, if we focus more on advocacy for the entire system, which is good practice as social workers, then we can help to avoid becoming an agent of any one member of that family or any one agent of that partner. So it's a good practice to focus on being an advocate for the entire family or couple's system. And I think that avoids a lot of those issues. It can get very tricky though. So, also, another thing that I think you should keep in mind is your own values and how they pertain to what you're doing in your social work practice with families and couples. For example, your values pertaining to marriage or divorce or traditional versus non-traditional lifestyles or gender roles, division of responsibilities in families, how people rear their children, the impacts of extramarital affairs, all of your values about those things can impact your work with families and couples. And this is is certainly true when you work with individuals, but it especially applies in situations where you're working with couples and families, because you're going to run into a lot of those issues, and you do have feelings about that. As social workers, we're not blank slates. I wish at times we were, but we're not. So we need to keep in mind that our values can have a big, big influence. Even our own family of origin issues may influence our perceptions of the problem or how the problem needs to be solved in another couple or family type situation. So, even without meaning to, you may take sides with one family member over another based on your own values. I'd like to tell you it doesn't happen, but it would be hard not to, because we're human beings and we have our own feelings and we do have our own values. Sometimes we impose those values on a family. We don't mean to, but we do. Sometimes we want to keep families together when really that's not in the best interest of the system. Sometimes we're more invested in seeing a family dissolve because our opinion is their issues are such that they would be better off apart. Again, that's our values influencing the situation. For further reading on that, Corey and Callahan in 2011 wrote a book that talks about ethical situations, and they did a lot of work in that book on family and group and couples counseling types of situations. We're going to look at one of their scenarios right now. Now, Frank and Judy, they're a couple, and they've experienced many conflicts in their marriage and finally decided to go to a marriage counselor. They've been thinking of divorce with increasing frequency, but still have some hope that they can salvage this marriage, so they've come to you. Now, you as a social worker may have three different perspectives, let's say. Let's say your first perspective is that you're a social worker who believes that it's not your place to bring your own values into family therapy sessions. You have biases regarding marriage and divorce, but you're not going to impose or expose them to the clients. Your primary interest is to help Frank and Judy discover what's best for them as individuals and as a couple. So you let them know that your job is to help them be honest with themselves about their issues, about the relationship, and you're an advocate for that system. Now, what if you're a social worker who has been married 3 times, however? You believe in marriage, but you're quick to maintain that many couples suffer unnecessarily by staying in marriages that aren't working anymore. So you're going to explore Judy and Frank's conflicts. Your interventions are going to lead them towards the direction of a divorce because you yourself see that as a very viable option in situations where marriages, are suffering and people in marriages are suffering. So you suggest a trial separation, and you suggest that you're willing to counsel them individually with some joint sessions. Well, they may express some reluctance to divorce due to the welfare of the children, but you then focus on the harm that's being caused due to them being in a destructive relationship. So you've got Counselor 1's perspective, and now Counselor 2's perspective tends to be slanted or skewed towards dissolving a relationship. So already you can see how the outcome of that intervention is going to be different just based on the values of the 2 social workers. Let's try a third type of social worker value. Now, in this third value, the social worker states their belief in the preservation of marriage and of the family. So in this instance, you're feeling like too many couples take the easy way out and divorce too quickly. They should work harder on their issues. Maybe sometimes they even have unrealistic expectations of marriage, which causes them to want to divorce too quickly. So you urge Frank and Judy to consider the welfare of the children and try to stay together, because you know you have a bias towards saving marriages, so you can try to make an informed decision about working with them, and they can make an informed decision about working with you about the preservation of the marriage. Well, again, that's a third completely different perspective. You're all about preservation of the family and preservation of the marriage, but again, it's your value that's dictating then what your intervention is going to look like. So in the third scenario, the couple's more likely to stay together, but is that because it was their decision, or is that because you imposed your value without even realizing it? It's interesting when you look at it this way, isn't it, that your perspective and your values could have led to 3 completely different interventions in this scenario. Okay, so what kind of obligations do we have? Well, as I've discussed before, in a mandated reporting situation, you have to disclose abuse, and that's something that you need to let the family know, even if it means that the family does dissolve because they can't handle that information. But also, if anyone threatens anyone or anyone becomes suicidal, you still have duties to handle that the way that you would in any other situation. You need to do a tear-us-off evaluation if somebody tells you they're going to harm someone else in the family structure, or if someone says that they are going to commit suicide, you have to protect that individual from themselves in the context of couples or family therapy. So then the therapy itself takes a back seat to your lethality assessment. That has to happen no matter what. Now, what about domestic violence cases? I get asked this question a lot. You're doing couples counseling and you become aware of domestic violence in the couples situation. Well, for one thing, you need to make sure that if someone needs protecting, you're getting them protected. If that requires releases of information or some other intervention to make sure that the person is doing what they're supposed to do to protect themselves and you're helping to protect them, that's very important. One thing you cannot do is continue to do couples counseling in a domestic violence situation. You absolutely, positively must discontinue counseling.
Pausing because the screen went up.